Hey everyone, so in this video we're going to talk about the classification of joints. So we're going to talk about three main categories of joints and just kind of how they function in the body. So the one we're going to start off with is the synarthrotic category. Synarthrotic is going to be any type of joint that is immovable. It does not move. So the first one, the first example of a synarthrotic joint is going to be a gymphosis. That's going to be our top one here. And a gymphosis is the type of joint that is going to keep your tooth in your mouth, essentially. So B is going to be our tooth. And each tooth has a socket that it fits into. It's called the alveolar socket. I'm going to label it as socket. Your teeth are surrounded by a tissue that we refer to as gingiva. You may have heard of gingivitis, which is inflammation of the gums. So gingiva is your gums. E is the alveolar ridge. In other words, it's the ridge that is surrounding that socket. And then lastly, we need something that's going to help hold our tooth into the socket. We're going to have a bunch of ligaments here. And since they're surrounding the tooth, our term is perio. And then the word for, anything pertaining to the teeth is dental. So this is the periodontal ligaments. And those are going to help keep our teeth in place. And as long as you don't have any type of malformations or illness that's causing any, changes in your gums, this type of joint should not move. With the exception of when your baby teeth wiggle around because they're ready to come out. Another type of synarthrotic joint is going to be the suture. Sutures are found in the skull. It's going to hold our cranial bones together. I like this image up here on the right side because it's showing you how it's very jagged and kind of like rough pieces so that they can kind of act like fibers that are threaded together. And it's part of another reason that this is referred to as a fibrous joint. Our specific example here is our sagittal suture. And then our last example of a synarthrotic joint is a syndesmosis. A syndesmosis is going to be the type of joint that we find between two bones that are close together or span the same region. So for example, your ulna and radius are both found within the forearm. They're going to have a syndesmosis, as are the tib-fib in your lower leg. If we label the skeletal portions that we are should be very familiar with, we've got the tibia and the fibula, right? The membrane that's traveling between them, very similar to that of the ulna radius, is our interosseous not margin, interosseous membrane. We've also got two different ligaments here. This one is showing you a posterior attachment. It's going to be our posterior tibiofibular ligament. This one here, you can see that it's moving in a horizontal plane. That's going to be our transverse plane, which is why it's named the transverse tibiofibular ligament. And again, the joints on this page are going to be our synarthrotic joints, meaning that they do not move. As we move on to our next page, we've got our amphiarthrotics. These are going to show just a little bit of movement. And our first example here is our sternal rib junction. The sternal rib junction is an example of a synchondrosis. And now that I just realized, even though this is the sternal rib junction, A is referring to a synchondrosis. My apologies. This whole thing is the sternal rib junction. Because here we've got the sternum, although it's, pointing to the manubrium there. D is our ribs. If you recall, these features, these notches here, are the costal notches on the sternum, or the costal grooves. That's because costal cartilage is going to attach there. And that costal cartilage is what's going to make it a synchondrosis. In the following here, we've got what looks to be the end of the femur. Again, this is going to be a synchondrosis. While it doesn't move in the aspect that you would typically think a joint moves, there is technically movement because this plate is going to be where growth occurs. So it is your growth plate, otherwise known as the epiphyseal plate. And this here is just showing the bone. And then lastly, we've got an example of a symphysis. Sorry, just had a pop up. There we go. We've got our example of a vertebral disc. Which is going to be our cartilage here. We have our vertebrae and sacrum. The vertebral discs, it's not a whole lot of movement there, but it does allow movement. So that's important. Just like the pubic symphysis, it's not a whole lot of movement, but movement is possible, and it's because we've got that section of cartilage between the bone. Last section we're going to cover is our synovial joints. These are going to be our diarthrotic joints, and diarthrotic meaning that they are freely movable. And before we really get into the types of freely movable joints, we should talk about the features that each of these joints will typically have. Okay, so if we look at this top image here, we have a section of bone here. And surrounding the joint, hopefully I didn't make that too difficult to see, we have our joint capsule. So I think of it as we have this section that's going to encapsulate, right, the joint. It's kind of enclosing the entire thing. In between, in the middle, we need to have a cavity that's going to allow fluid. This is showing our synovial cavity, which is going to fill with synovial fluid. This is going to allow lubrication in the area, as well as a little bit of, not necessarily shock absorption, but a bit of cushion. This here, these little triangles here, these are sections of ligament known as the menisci or the meniscus. It's like a fibrocartilage. And they're kind of like padding. You find this, if anyone has been familiar with knowing somebody who's torn their meniscus in their knee, you have your lateral and medial menisci there, and those are those fibrocartilage pads. Additionally, E is looking at the type of cartilage that is at the epiphysis of any long bone. That's going to be our articular cartilage. Sorry, I'm running into the diagram. And I drew over what G is pointing at. And lastly, G here, we're going to have our synovial membrane. That's a little bit messy. As we move on to the next image, right now we're looking at kind of the encapsulation of a tendon that's running along a bone. And F is what we know as our tendon sheath. B remains our capsule. You can see here that C is going to be our cavity. And so that cavity is going to fill with synovial fluid. Because it's able to fill, that means there needs to be a membrane there. And that's going to be our synovial membrane. And lastly, A is the bone. So whenever you have a tendon, think about if a bone is kind of, maybe a rougher surface, that tendon is constantly going to be moving according to how the muscle is acting. If the muscle's contracting, relaxing, there's going to be some movement across the bone, and we don't want any tearing due to friction. It's important that we have this tendon sheath to help protect, cushion, and lubricate the area so that we don't have any tearing. Some areas we're going to actually have the tendon not only rest against a bone, but actually wrap down and around it. A really good example of that would be the ankle, where the Achilles attaches to the calcaneus. Think about all the movement with walking when you're dorsiflexing and plantar flexing. There's so much movement there that you don't want that grinding to occur between the calcaneus and the Achilles. So we need to have some kind of cushion in between them to make sure that everything is remaining intact. So here we've got the bone here. This is specifically our calcaneus. We have our Achilles. And this is a bursa. And a bursa is kind of like a fluid-filled pocket, and that it serves its purpose of being a cushion to help protect the tendon from any grinding that might happen on the bone. The bursa is very similar to a tendon sheath. Essentially, a tendon sheath is just an elongated bursa. All right, that's our features for synovials. So let's go ahead and talk about the types of synovial joints. All right. First example here, we have a gliding joint. Gliding joints are going to move in multiple axes. So this is a multi-axial. And our specific example here is at the spine, where we have our superior articular facet, or process, below the superior articular process, we're going to have our inferior articular process. And the body of our vertebrae. Right? And so if you recall when we went over bones, each articular process has a smooth region that we refer to as a facet. These facets are going to slide against one another, and that kind of allows for range of motion in our vertebral column. The next example that we have here is a hinge joint. A hinge is an example of a uniaxial. This is an I, meaning that you can only have flexion extension here. And this particular example is of the elbow. So we have our humerus here. We have the ulna. And here you can see that we've got the trochlea surrounded by the trochlear notch of the ulna. And they're going to work together to allow flexion extension. Just beyond our elbow, we have the joint that's going to allow pronation supination, which is an example of a pivot. So a pivot is our other example of a uniaxial. Another example would be the dens in the atlas, so that you can turn your head left and right in that direction. So here we have our ulna, we have our radius. The head of the radius is rounded and it fits very nicely in the radial notch of the ulna, and we're going to have rotation here, or a pivot, so that we can pronate and supinate our palm. In other words, palm up, palm down. Last page here, we have a ball and socket. This is a multi-axial, meaning it moves in multiple planes. Specifically, our femur, and even though it's not labeled, is fitting up into the acetabulum of the pelvis. We then have our ellipsoidal. For example, our carpals and the radius. We can have a flexion extension as well, a bit of adduction abduction here, because we can move in those two planes. This is going to be a biaxial joint. And similar to also biaxial, but similar to ellipsoidal, we have the saddle joint. And a saddle joint is also biaxial. We can do very similar movement. We can kind of get a little bit of adduction, abduction, flexion, extension, but this time the bones where they are connecting are concave, kind of like, you know, the saddle of a horse. And here's an example of the metacarpal and the first phalanx. No, I lied. Sorry. The first metacarpal and the trapezium. Right, so where the metacarpal of the thumb meets the carpals. All right, that's it for these joints here. This is just kind of our overview, and if you have any questions, be sure to let me know.